and Pennsylvania have now joined 6 other states in declaring measles outbreaks.
Last week, U.S. measles cases topped 700 cases, with Texas reporting the majority of them. And this all comes as vaccination rates across the country are declining. Tonight, we're speaking with experts about who may be vulnerable, even here in California, where to date we've seen just 9 cases of measles this year. KRON 4's Dan Kerman is live in the newsroom with more on this predicament. Good evening, Dan.
Good evening. You know, because fewer people are vaccinated than any time in recent history, we're having to have conversations we didn't have before. That's because that herd immunity, where the community protects each other through being vaccinated, may not be the case everywhere you go, even in parts of California. As measles makes a comeback across the country, a report from the California Department of Health shows vaccination rates among kindergartners in the state remain above the national average. Still, there's been a drop in vaccinations from the 2022-23 school year to the 2023-24 school year, and that includes a decline in measles vaccinations.
I have a lot of concerns about the drop in immunizations at the kindergarten level.
UCSF infectious disease specialist Dr. Peter Chin Hong says while overall statewide vax rates remain above 95%, which is required for herd immunity, a number of school districts throughout California have dropped below that number.
We all rely on each other to protect the more vulnerable in our community. And as the number of people who are immunized and who are protected in the community decreases, that leaves the people who can't mount an immune system very vulnerable, or people who've lost immunity over time.
And there are several adult populations that may not know they are vulnerable.
For those people born before 63, if they don't know if they've had the measles or not, talk to your doctor. There's 2 things you can do. One would be to get a blood test that shows antibodies if you've had measles before, and if they're positive, you're home free. If it's negative, then probably should get vaccinated.
UC Berkeley infectious disease specialist Dr. John Schwartzberg says those vaccinated between 1963 and 1968 should also speak with their doctor, because the measles vaccine given at that time was weaker than the one they've been giving since 1969.
There was a vaccine available between 63 and 68, but it didn't work very well. And because of that, if that's when you got immunized against measles, you should talk to your doctor about getting the primary series of measles vaccine again. That is 2 jabs.
So those vaccinated before 1969 may need a booster, and those who don't know if they had measles before 1963 need to find out. Medical experts say there's no need for panic, but with measles outbreaks and declining vax rates, we do need to keep our eye on the ball and make sure we're as protected as we can be. Live in the newsroom, Dan Kerman, KRON 4 News.
All right, Dan. Meantime.